Fletcher, I'm a board-certified family nurse practitioner and a partner. I'm a partner in a family practice in Putney. Putney is a great community, very diverse population there. I heard when I first got there 25 years ago, I heard a rumor that if you raise your children to have high ideals and treat people fairness and kindness, that your children might even grow up to be governor. So. I had 3 daughters. They chose a different track, so I'm doing all the political stuff. Just a brief of where I've come from in my quest to be standing here today is that I've been in healthcare. I have a master's degree in rural community health, and I'm the past president of the Vermont Nurse Practitioner Association. I was a board chair of the Vermont Program for Quality Healthcare, also on the board of the Southern Vermont AHEC group, as well as spending 10 years as the Vermont representative for the American Academy of Nurse Practitioners, going to Washington, talking to the legislators there, and trying to promote health care for all. 25 years ago, when I first arrived in Putney, I got a job at Brattleboro Hospital working in the emergency room. I actually ran the emergency room. It was before there was a physician in small community hospitals, and so I ran the emergency room there, and I started to notice a trend of patients coming more and more who were not emergent. They did not have health care, but they ended up getting primary care services by me in the emergency room at quadruple the cost they could have gotten it in the primary care office. A lot of these people had primary care providers, but they still could not go see those providers because they did not have proper insurance, and also they might have had insurances that they paid dearly for, but had $2,500, $5,000 copay. So it was almost useless if you didn't have that kind of cash outlay. I also went to primary care after that and noticed that continued trend that I was seeing patients that were either coming to me. We had to give them discounts because they couldn't afford it, and when we gave them prescriptions for medications, later we found out that they did not take them because they could not afford them. Like the Manganellos, back at that time in 1991, as a matter of fact, several people in my community of Putney started to look at that issue, and basically we got together and formed the Putney Free Clinic. It actually was the first free clinic in Vermont 2 months before the neighborhood clinic opened up, as a matter of fact. But at our open house, then Lieutenant Governor Howard Dean came, and he was very supportive of starting this whole clinic. But at that time, he vowed that he would work tirelessly to get a universal health care coverage for all that was affordable and that was for all providers in Vermont. At that point, I applauded him for that, and my next goal was really going to be to put myself out of business as soon as possible. With universal health care coverage and any kind of single-payer system, you do not need free clinics. Right. So 2011 arrives 20 years later. Not only I have not put myself out of business, but our clinic is thriving. We continue to not see poor people. Poor people have Medicaid. They have Medicaid. They have health insurance. It's the people who are the working people who are not offered insurance, have high deductibles, have high copays, that are suffering, and those are the type of people that we're seeing in this clinic. And I want to move forward with this system, a single-payer system that offers not a fragmented system of multiple. The cost of these free clinics are large. There's a whole network of money streams that go to these free clinics that could be better utilized. Federal monies, state monies, everything. So I think that this is one aspect. We could get rid of these free clinics. There are healthcare providers that can see these patients, except in the psychiatric world. That's a biggie. We need more providers in that. But that's why I support the single-payer system, and that's why I'm here. Thank you.